When we do our cupping here at 180 Therapies, one of the things we like to do is use a little bit of unscented lotion. It's chemical free, and one of the reasons we do that is so that the cups that we use actually create a better seal. What we're going to be using is called dry cupping, so it's just a straight vacuum with a little bit of medium. So we're going to warm Tommy up, connective tissues, soft tissue work. Now, for any of you therapists that are out there watching me, you'll notice that I have my table kind of high, and the reason I do that is because I am trying to work with the connective tissue more. I like a lot of fascial work. I know that I'm using a little bit of medium, but Tommy also has a little bit of hair on his back, and I don't want to sit here and rip it completely out. I like to pull and push directionally. I go with latissimus dorsi, with the erector spinae bundles, anything that I'm going to be placing the cups on. These particular ones are AccuZone cups. I sterilize them with hot water, antibacterial soap, and then I go through and wash and clean them with a Clorox wipe. So try to keep them as sterile as possible, because you never know what's going to come up. So for this particular thing, this is your little air gun. I'm going to check where his spine is, and I'm going to go right out to the outside of the transverse processes, which is the little bony prominence that hooks off the side. I'm going to give it 2 pumps. Bloop. And I do like to make sound effects. Now, there is a lot of information on the web about cupping. Some of the stuff I agree with, some of the stuff I do not. One of the main things that I personally like about cupping is the fact that it is a natural analgesic. It helps with what are called nociceptors. Nociceptors are pain receptors. So there are studies that show once cupping has been applied and you release these guys here, what will happen is you notice a decrease in pain because the way it directly affects the nervous system.